everyone. Today we're going to talk a little bit about hemodynamic monitoring, specifically cardiogenic pulmonary edema, okay? So which of the following represents cardiogenic pulmonary edema? And if you notice, this is really a multiple choice question, only it moves horizontally rather than vertically. So we've got cardiac output, wedge, and pulmonary artery pressures to decipher through. So the best way to explain this is, let me give you a picture. So if you've seen this picture before, I've got it on my YouTube channel, Blood Flow Through the Heart, and it works us forwards through this process. But basically when we look at this, if we are tracing blood flow through the heart and a patient has a Swan-Ganz catheter in place, that Swan-Ganz catheter is able to measure that cardiac output, wedge pressure, PAP, and CVP. So if you look at the previous question, what we're looking at is cardiac output, wedge, and PAP. So let me explain it as far as cardiogenic pulmonary edema. So cardiogenic pulmonary edema means the left ventricle has probably failed for whatever reason. All right, so when the left ventricle fails, it cannot pump blood out into systemic circulation like it should. So that blood pools in the left ventricle. So if we're talking about cardiac output and the left ventricle cannot pump appropriately, that means cardiac output, and this is how that's abbreviated, is going to be lower than normal, okay? So if the left ventricle is not pumping it out, the ventricle fills with blood, and eventually that left ventricle can't contain it anymore, so blood backs up to the left atrium. And so the whole left side of the heart is engorged with blood. Well, pulmonary capillary wedge pressure tells us about left heart pressures. And so that's going to be increased also, all right? And if we don't do something for the patient to alleviate this, blood continues to back up through the pulmonary vein and into the pulmonary capillary bed. All right, so that excessive blood gets into the pulmonary capillary bed, and that causes the PAP to elevate. All right, so decreased cardiac output, increased wedge, and increased PAP. So let's roll this backward and look at this question again. We said decreased cardiac output. So all of these say decrease, except this one. So it's not D. We also said it had an increased wedge. So increased wedge, decreased wedge. It's not that one. And then we said an increased PAP. So B is the one that signifies cardiogenic pulmonary edema. All right, and then when we come to the second question, which of the following would treat the root cause of cardiogenic pulmonary edema? Well, cardiogenic pulmonary edema means the left ventricle is not pumping hard enough, not pumping up enough cardiac output. And typically what we want to do with that is to increase the contractile force of the left ventricle. And medications that do that are called inotropic agents. These are medications like digoxin or digitoxin, all right? So beta-adrenergic agents, we typically think of them as the medications we give in breathing treatments, albuterol, Xopenex, those type of medicines. Vasopressors are going to be medications that cause vasoconstriction. They bring up a low blood pressure, so they elevate BP. And fibrinolytic agents are clot-busting agents, okay? So they're able to take, like if a person has an MI and qualifies for fibrinolytic therapy, that will break up any kind of blood clot that's in the coronary artery. So these have to do more with clotting issues. So A is the correct answer. If you're having trouble with hemodynamics and you would like to know more about these pressures, CVP included, on my website, respiratoryhq.com, I have a very inexpensive hemodynamics mini course that will kind of help explain this whole process. So I hope this helps. See you soon.